If you're over 70 and you have a medical implant inside your body, there is something happening at airports right now that nobody is warning you about. Every year, airport scanners get more sensitive. What used to pass through security without a beep 5 years ago now sets off alarms almost every single time. And if you have a hip replacement, a knee implant, a pacemaker, a spinal rod, or even an insulin pump, you are walking into that security line with a target on your back and you probably don't even know it. Here's what makes this so frustrating. These are life-saving devices. Your doctor put them inside your body to keep you alive, to keep you moving, to keep you out of pain. But the moment you step into an airport, those same devices can turn your travel day into a nightmare of blaring alarms, pat-downs, confused officers, and in some cases, actual medical risk to the device itself. Over 90% of hip and knee replacements now trigger airport metal detectors. That's not a guess. That's what the medical research shows. And it gets worse. There is one specific type of implant that the TSA themselves say you should never walk through a standard metal detector with. If you do, the electromagnetic field could interfere with how the device works. We're going to tell you exactly which implant that is, what can happen, and the precise words to say to any TSA officer so it never becomes your problem. But most travelers with implants don't know any of this. They show up at security, the alarm goes off, everyone in line stares, and suddenly they're standing in a glass booth being patted down by a stranger while their boarding time ticks away. It doesn't have to be that way. In this video, we're breaking down the 6 most common medical implants seniors fly with, exactly what each one triggers at security, which scanners are safe and which ones aren't, and the specific scripts you can say word for word at the checkpoint so you move through security calmly, quickly, and without a single surprise. Before we get into it, tap that subscribe button and turn on notifications so you never miss another tip that makes flying with a medical device completely stress-free. Let's get into it. Let's start with the implant that affects more senior travelers than any other: hip and knee replacements. You spent months recovering from surgery. You did the physical therapy. You finally feel strong enough to travel again. And then the very first thing that happens when you get to the airport is the metal detector screams. Every head in the line turns to look at you, and a TSA officer is waving you to the side before you even know what happened. Here's why it happens. Your new joint is made of metal, titanium, cobalt chromium, stainless steel, or some combination of all three. These materials are incredibly strong, which is why they work so well inside your body. But they're also incredibly easy for a metal detector to find. Studies show that over 90% of total hip and total knee replacements trigger the walk-through metal detector at airport security. In one study of 143 hip replacement patients who traveled by air, 120 of them set off the alarm. That's 84%, and the numbers for knee replacements are even higher. And here's something most people don't realize. The sensitivity of those detectors changes. It varies from airport to airport, and even from day to day depending on the current security threat level. That means you might walk through just fine in Orlando, but get flagged every single time in Chicago. You can't predict it, but you can prepare for it. Here's exactly what to do. Before you step into the security line, walk up to the nearest TSA officer and say this: "I have a hip replacement, and I'd like to request the body scanner instead of the metal detector." That body scanner is called advanced imaging technology, and here's why it changes everything. It will show your implant on the officer's screen, but it will not sound an alarm. No beeping, no staring, no getting pulled aside. It's a completely different experience. You should also know about the TSA notification card. It's a small card you can print from the TSA website or request from your doctor's office. You hand it to the officer and it discreetly tells them you have a medical implant without you having to announce your surgical history to 30 strangers in line behind you. Now, the card won't exempt you from screening, nothing will. But it speeds up the conversation and puts you in control from the first moment. One more thing. Always give yourself an extra 15 to 20 minutes at the airport. Not because something will go wrong, but because knowing you have that cushion turns the whole experience from stressful to simple. Now hip and knee replacements trigger alarms. That's annoying. But the next group of implants we need to talk about can actually interact with the scanner itself, and that changes everything. We're talking about spinal hardware and spinal cord stimulators. These are two very different things, so let's break them down one at a time. First, spinal hardware. If you've had spinal fusion surgery, you likely have metal rods, screws, or plates holding your spine together. These work a lot, like a hip or knee replacement at security. They're made of metal, the detector picks them up, the alarm goes off, and you get extra screening. Annoying, yes, but not dangerous. The same advice applies here. Ask for the body scanner, carry your notification card, and give yourself extra time. Simple. But spinal cord stimulators are a completely different story. A spinal cord stimulator is not just a piece of metal sitting in your body. It's an active electronic device with a pulse generator implanted under your skin. It sends tiny electrical signals to your spinal cord to help control chronic pain. And because it's electronic, it doesn't just get detected by scanners, it can potentially be affected by them. Both Boston Scientific and Medtronic, two of the biggest makers of these devices, tell patients the same thing. Request to bypass the security screener. Tell the staff you have an implanted medical device. If you must go through, move through as quickly as possible and stay as far from the equipment as you can. And this isn't just a theory. In May of 2024, a woman in Atlanta told TSA officers she had a spinal cord stimulator. She showed them her medical ID card. She asked for a pat-down instead of the scanner. According to her lawsuit filed in early 2025, the agents ignored her requests and told her the only way she was getting on that plane was to go through the machine. She went through, and she claims the device malfunctioned afterward, requiring medical attention. That's why this one matters so much. You have to speak up and you have to be firm. Here's what to say. I have a spinal cord stimulator. My device maker says I should not go through the scanner. I am requesting a pat down. Say it clearly, say it calmly, and know that you have every right to make that request. The TSA's own website confirms that any passenger can opt for a pat down instead of any scanner. This is not a favor. It is your right. Remember earlier when we said there's one implant that the TSA themselves warn you about? One device they specifically say should never go through a standard walk-through metal detector? This is it. Pacemakers and implantable defibrillators. If you have one of these devices, this might be the most important few minutes of this entire video. A pacemaker keeps your heart beating at the right rhythm. An implantable cardioverter defibrillator, or ICD, monitors your heart and delivers a shock if it detects a dangerous rhythm. These devices are keeping you alive every single second of every single day. And the TSA's own website says it plainly. You should not be screened by a walk-through metal detector if you have an internal medical device such as a pacemaker. That's not our opinion. That's directly from the Transportation Security Administration. Here's why. Walk-through metal detectors and especially handheld security wands create electromagnetic fields. And electromagnetic interference is a known concern for cardiac devices. In theory, it could cause pacing problems or even trigger an inappropriate shock from a defibrillator. Research shows that 80% of patients with these cardiac devices report fear and anxiety about going through airport security. 80%. That's not a small number. That's almost everyone who has one of these devices worrying every time they fly. But here's the good news, and this part matters just as much. A major study at the German Heart Center Munich tested 375 patients with pacemakers, defibrillators, and other cardiac devices using the same type of full-body scanner you'll find at most airports today. The results showed zero evidence of electromagnetic interference, zero device malfunctions. The body scanner is safe. It's the walk-through metal detector arch that you need to avoid. So here's exactly what to say when you reach the front of the security line. I have a pacemaker. I should not go through the walk-through metal detector. I'd like the body scanner or a pat-down, please. Carry your medical device ID card with you. Both Boston Scientific and Medtronic provide these cards, and Boston Scientific even offers a version printed in 13 languages for international travel. And one more thing from the American Heart Association. If a TSA officer does use a handheld wand on you for any reason, ask them not to hold it near your device any longer than absolutely necessary. This is not about convenience. This is not about saving a few minutes in line. This is about a device that is keeping your heart beating. Knowing what to say and what to avoid could be the difference between a routine screening and a genuine medical scare. Joint replacements and pacemakers get all the attention when people talk about implants and airport security. But there are several other devices that seniors travel with every single day that cause just as much confusion at the checkpoint, and almost nobody talks about them. Let's fix that right now. First, insulin pumps and continuous glucose monitors. Millions of seniors manage diabetes with these small devices attached to their body. And here's what catches people off guard. When you walk through security wearing one, the TSA officer is going to see something on their screen and they're going to want to investigate. The TSA says you should tell the officer exactly where your pump or monitor is attached before you step into any scanner. You will not be asked to remove it. But you should expect what they call a self-pat-down, where you touch the device area yourself and then the officer swabs your hands to test for traces of explosives. It sounds intense, but it takes about 30 seconds once you know it's coming. One important detail. Some insulin pump manufacturers warn that certain models should not go through X-ray machines. That applies to the X-ray belt your bags go through, not just the body scanner. So, before you fly, check with your pump's manufacturer to be sure. Next, cochlear implants. If you wear one, the good news is the TSA says you do not have to remove it for screening. You can walk through metal detectors and body scanners with your sound processor turned on. However, the internal magnet and external processor may trigger the metal detector, which means you could face additional screening. A simple trick many experienced travelers use is to remove just the external sound processor before walking through, then clip it back on once you're on the other side. No alarm, no fuss. And then there are the devices people rarely think about until they're standing in the security line wondering what to do. Sacral nerve stimulators used for bladder or bowel control, bone growth stimulators worn after a fracture, chemotherapy ports implanted in the chest. Every single one of these can show up on a scanner, and every single one should be declared before screening begins. Here's a script that works for any device you might have. I have an implanted medical device called, and then you say the name. It's located, and you point to the spot. What's the best screening option for me? That one sentence puts you in charge of the conversation instead of reacting after the alarm has already gone off and everyone is staring. Here's the thing most people get wrong about flying with a medical implant. They think the implant is the problem. It's not. The problem is walking into that security line without a plan. And now you have one. Let's put it all together so you never forget it. Step 1. Know your device. Know exactly what it's called, what it's made of, and where it's located in your body. When a TSA officer asks you what you have, you need to answer clearly and confidently. Not, I think I had something put in my shoulder a few years ago. That kind of answer slows everything down. Instead, say the name, point to the spot, and tell them what you need. Step 2. Call TSA Cares before your trip. This is the one most people have never heard of, and it might be the most valuable tip in this entire video. TSA Cares is a completely free program run by the Transportation Security Administration. You call them at 855-787-2227 at least 72 hours before your flight, and they will arrange for a passenger support specialist to meet you at your checkpoint. That's a specially trained TSA officer whose entire job is to help you through the screening process smoothly. No extra cost, no membership, just one phone call. Step 3, carry your documentation, your medical device ID card from your implant manufacturer, and optionally a TSA notification card. Neither one will get you out of screening. Nothing will, but both of them speed up every conversation and keep you from having to explain your entire medical history out loud. Step 4, speak first. Always tell the TSA officer about your device before you step into any scanner. Every script we've given you in this video works because it puts you in control of the interaction before the alarm ever has a chance to go off. Step 5, know your rights. You can always request a pat-down instead of any scanner. You can always request private screening, and you can always request a chair if standing is difficult during the process. And if you're 75 or older, you already qualify for some screening modifications, including keeping your shoes on, which makes the whole experience faster when you combine it with TSA cares. Flying with a medical implant does not have to mean flying with anxiety. You survived the surgery. You can absolutely handle the security line. Now, which implant do you have? And what's been your experience at airport security? Drop your story in the comments. Share this video with someone you love who flies with an implant. It might be the most useful things they watch all year. And if you haven't already, hit subscribe so you never miss another tip like this. We'll see you in the next one.